In Mildura, for the people who are living with viral hepatitis, what are the care pathways and support services and current treatment options available to them?
So there's two areas where you can access care in Mildura. You can access it through the hospital, but that's for more sort of public patients that access hospitals. So we have Sunraysia Community Health Services, which do an outpatient service, and Dr. Kumar and Joe Sassadus are both there. So we offer the ability to treat hepatitis C and manage hepatitis B there. And we've got a GP, Dr. Kalichi, and he also will treat non-cirrhotic hep C patients.
Okay. And for patients who are wanting to access those services, how do they go about getting a referral or accessing the services?
So it's a self-referral in. So for hepatitis C, most certainly you can just self-refer in. So it's ringing Sunraysia Community Health, and you can access it with a simple appointment with myself. With hepatitis B, it's very similar, but there is just another layer of just a referral from a GP that we need to see the specialist doctors that visit. Yeah. So
okay.
Both can be self-referral in. And I think it's worth mentioning also that Midas do treatment for both hepatitis B and hepatitis C as well. So they've also got a service there, which is a similar self-referral in, and you'll see the GP there. Yep.
Okay, fantastic. Obviously, there are some gaps, and when we talk about viral hep, we talk about the barriers to treatment. In your experience, what would you say the barriers to treatment are?
So barriers to treatment, we see a lot, and we've spoken about this a lot today, so competing priorities in a person. So it's where they've got, you know, mental health issues, might be some substance abuse issues, and probably treating their hep C is probably not highest on their priority list. They might have instability in their housing, so homelessness, and these all impact on a person's ability to actually, one, access care, and two, engage in care. So that's a really important factor in hep C treatment. And also it is also with hepatitis B, you know, management as well. So the issues we see is, you know, people may or may not have a GP that they're currently engaged with. And so that ability to know whether they are positive or not for hepatitis C, they just might simply not know their status, and they mightn't have that access there to see a doctor to find that out. There might be some stigma that's attached to why they're not accessing care, and there might be some distrust within the health system. So all of these things really impact on a person's ability to come and get tested and then get treated or engage in care. Yep.
Absolutely. As someone who sees patients in this industry, what do you think as healthcare workers, the strategies that we can implement to overcome some of these barriers and engage more people in care are?
So I think some of the most important things we can do is have a non-judgmental environment, destigmatise the environment around hepatitis, and make the space very safe for people to come and disclose previous histories of injecting or their knowledge of a previous, you know, having hepatitis, and offer them a confidential service that provides the care they need. But also sometimes you need to sort of provide care that goes outside the normal parameters of just offering care within a health service. So sometimes you may need to do more home visits. You might need to help with medication provision, particularly with hepatitis C, because some of these issues are why they haven't engaged in care and why they haven't started taking, you know, accessing treatment for hep C. So it might mean that you need to pick their medications up from a pharmacy and deliver them to their house so that they take their 12-week course of treatment for hepatitis C. So they're all the things that you need to really assess with an individual and just tailor some care planning around what the needs are of that person. Yeah.
It really sounds like it's take those extra steps, go that extra mile to get people across the line. On another note, we're aware that needle and syringe programs are a really good way to prevent hepatitis C transmission. Can you tell us a little bit about the NSP that's available at Sunraysia?
Yep. So we do have an NSP service at Sunrise Community Health. You can access that in business hours by coming to the front reception of health, and it's just a simple present and they give you your fit packs and off you go. So the service is free and it is vital in reducing the risk of transmission of hepatitis or bloodborne viruses, and it offers that safe injecting equipment for people who are injecting. So I believe that MDUS has an NSP as well. So it's a very similar setup to Sunrise Community Health. So there's 2 points of access in Mildura. There is also a vending machine at our service. It has periods where it's out of use because of issues with it, but when it is in use, you can access after hours some fit packs, which is really important too.
Fantastic. And I'm going to go off script here a little bit. Dr. Patel, would you like to take the opportunity to tell us a bit about the NSP that's available at MDUS? Sorry to put you on the spot.
That's okay. Hello, everyone. Thanks for the opportunity. Yes, we do have similar arrangements, as Yasmin mentioned, for the Indigenous patient group that we have at MDUS. Unfortunately, that is only available via during the business hours. We do not have the facilities at this stage for after hours, but worthwhile to note that many pharmacy in the region also has free of charge feedbacks as well. So outside of those 2 services, there is a plenty of services available for NSPs, and that is also free of charge as well. So provides a safe injecting materials for the patients that they need it. But yeah, so pretty much similar to SCHS.
Fantastic. Thank you so much. It's
Thank
really
you.
good to know that there's some excellent services working with the community.